Right. Hello, my name is Cole Phelps, and this is our presentation for OSU Research Week. The presentation is titled The Biliary Tree of Knowledge, Assessing Cholecystitis Google Searches. Background. Cholecystitis accounts for anywhere between 3 to 10% of all patients with abdominal pain, and up to 200,000 per year in the U.S. suffer from it. Other research has proven patients commonly search the internet regarding treatments prior to any formal physician visit. Studies have also proven this trend in orthopedics and gastroenterology. However, no such trend has been studied in hepatobiliary diseases, especially in cholecystitis. So in this study, we sought to classify questions on cholecystitis as well as assess their levels of quality and transparency using Google's frequently asked questions. This was a cross-sectional design. The search was performed in January 27th, 2023. We used a clean and new browser, all data extracted in a mass in duplicate fashion. And here you can see a picture of what our search looked like. The following search terms were searched into Google: cholecystitis treatment, cholecystectomy, gallbladder treatment, gallbladder removal surgery. We then put those into Google and retrieved 325 unique facts. We then took all those frequently asked questions, we classified them in the Rothwell classification by fact, policy, and value. We also classified them by source, so sorted them into academic, commercial, government, medical practice, media outlet. And then by sourcing the information, we scored them using the JAMA benchmark for transparency and brief discern for quality. And here are our results, and you can see here that majority of our search gave back fact-based questions, and the number one source was from medical practices. You can also see here that restrictions and timeline seem to be the most popular subclassification by source type. So most people are asking what are the restrictions and timeline of recovery when having a cholecystitis or cholecystectomy type surgery and recovery. And here are our results for quality and transparency. Medical practices were unable to meet the JAMA benchmark in majority. Majority academic sources unable to meet the JAMA benchmark. Same with government in majority unable to meet the JAMA benchmark. Media outlets had the lowest brief discern score, but there were only 4 media outlets. Whereas medical practices, which was the majority, highest amount of sources, had the next lowest brief discern score at 12. Academics surprisingly had the highest brief discern score. So in conclusion, most questions searched on Google pertaining to cholecystitis treatments are fact-based questions regarding restrictions and timeline until we're gaining normal activities. Medical practices were the most frequent source recommended by Google, but their online information was the worst for quality and transparency. So we as physicians, should recommend good sources to our patients and educate them, but we should also encourage these websites and those of us who write to post information online to include date, author, and references, just to simply improve the quality and transparency of the article. People need to know that the information you're telling them is true and that they can go search it for themselves. And here's where you make your claims. Any further questions, please send to my colleague, Jared Van Vliet. And here are our references. Thank you.